Good morning, everyone, and welcome to this morning's multi-faith denominational assembly, and also to non-uniform day and to the last day of the half term. In a moment, I'm going to hand over to Nikki, Annie, Sienna and India, who are going to talk about the COVID crisis in India. They came to see me about holding a non-uniform day, and here we are. The money raised today will be divided between Parikmara and other charities identified by them that are also involved in fundraising. I thought I would start today by reading a letter from Kalpana, who's at Parikmara, and I think you all met her at St Catherine's Day. And here it is. It says, "Hi Simon," because that's my name. I'm not just called Mr Turner. He says, "How are you doing? It was great to see such great connectivity today at the reading session between the lower six at your school and our students. The kids are full of beans as usual. In fact, I wanted to ask you if you could help Parikmara in any way, and like a miracle, you spoke of a fundraiser. You know, our parents are again caught up in the midst of hunger and unemployment. Providing food for the students' families costs around 700 rupees per week. That's about £7. And when you multiply that by 2,000 families, you can see how much this is costing. And that will keep nutrition going for the Parikmara community. Our students' learning must go on if we are to keep them safe, prepared, and a whole education process for the mind, body and soul going. Online now. This costs around 600 rupees, around £6 per data pack per month per student. And you're thinking of 1,600 students. HAB's community has always come forward to lend us a helping hand and has been a true extended family member at all times. We appreciate this from the bottom of our hearts. God bless all of you. Warm regards, Kalpana." I'll now hand over to Nikki, Annie, Sienna and India, and at the end, Yethusia will say a little bit about the reading programme that has been ongoing for the past 6 or 7 months. Thank you very much.
Good morning, everyone, and welcome to today's assembly. Today we are talking to you about the reason we are all in non-uniform, to raise money for the COVID crisis currently in India. Whilst this has been out of the mainstream news for the past week, it's still an important issue. India has experienced around 280,000 deaths since the beginning of the pandemic, and this number increases by 4,000 every day. We are extremely lucky to have the privilege of measures like social distancing and access to hand sanitizer, which is simply not possible for the majority of people in India. People are crammed together in houses and the healthcare system is failing drastically. As a community with our sister school Parikmara in India, we should make it a priority to help others who cannot lead the same lifestyle that we do.
The first COVID cases arose in India when medical students returned from Wuhan, and lockdown was subsequently announced on the 23rd of March 2020. By the 10th of June, the number of recoveries exceeded the number of cases, with the number of cases hitting incredibly low numbers, below 15,000 people in a population of 1.3 billion. Seemingly over the pandemic and assumed to have reached herd immunity, lockdowns were lifted and life went back to semi-normal, including celebrations of festivals. In February 2021, a new variant was detected that we now call the Indian variant. This led to a massive second wave, surpassing over 1 million active cases. Crowded celebrations, lack of preparation in hospitals, and poor sanitary conditions caused cases to rise at an alarming rate.
As if the crisis in India wasn't already tragic enough, the unfortunate way in which the healthcare system is run worsens the situation. India, unlike the UK, doesn't have a free healthcare system like the NHS, which means that many people cannot afford free healthcare. The Indian healthcare system is drastically different in the sense that you would have to pay for every piece of medical treatment or equipment that your loved one uses. For example, if a relative is sick in the UK, an ambulance with paramedics and medicine would come and take you to the hospital. Once you reach the hospital, you are given a bed and treatment and equipment is used to nurse you back to health. However, in India, if a relative was to get sick, you would have to pay upfront for an ambulance, which may not even have paramedics or medicine in it. Once you reach the hospital, you wouldn't know if your loved one even had a bed, which you'd have to pay for. And if they did, then the doctor would make a diagnosis and give a recommendation for the treatment. However, unlike the UK, where the medicine is easily accessible, it would be your responsibility to go and search the streets and the black market for medical equipment, oxygen, and the medicine needed, which you would then have to give to the doctor so they can set it all up. All of this adds up to a huge cost, which many people in India, based on their low salaries and immense poverty just cannot afford. This is one of the main reasons as to why the death toll in India is so high, and with rising case numbers, essential items such as oxygen concentrators have decreased in supply and increased in price, leaving hundreds of thousands of people struggling for their lives and thousands of people in tragic situations.
Looking at statistics, the UK has had a total of over 4.4 million cases and a total of 127,651 deaths. India has a total of over 26.5 million cases and a total of 299,000 deaths reported. However, due to the high levels of poverty in India, these statistics are likely to be inaccurate as there would be many unreported cases and deaths, so the true statistics are likely to be higher. Whilst India was showing good signs of recovery after their first wave, 64 million doses of their vaccine, Covaxin, were shipped to 86 countries in Latin America, the Caribbean, Asia and Africa. However, in March, India placed a temporary hold on all exports of the vaccine, as the government said rising cases meant domestic demand was expected to pick up, and so the doses were needed for India's own rollout. Whilst other countries were struggling, India helped supply them with vaccines. Alongside this, India aided many countries like Myanmar and Bhutan with oxygen tanks to help hospitals.
As we all know, COVID-19 has affected India massively. In particular, children's education has suffered. In the face of this public health emergency, homeschooling has become the new norm. This digital shift may have been easier transition for most elite schools, but for children and students at Parikrama, this wasn't the case. Many of their children are not fortunate enough to own cell phones or laptops. Taking initiative, Parikrama schools started a program to train their teachers while simultaneously raising funds and taking donations for second-hand phones and laptops. They also started to provide students with mobile data that enable the children to have at least a few hours a day of schooling.
Not only has the pandemic affected education in India, it has also greatly impacted the mental health of many. Most of the children in Parikrama school live in small homes, sharing the space with 3 to 5 family members. Rising to the challenge once again, the school established an SOS call system, accessible to families with counsellors on call at all times. COVID-19 has been especially hard for this community, but they have found a way to adapt and overcome these challenges. Now I'm going to hand it over to Yathusia, who's going to speak about the reading.
Since the spring term, my friends and I have been reading to the students at Parikrama as part of their weekly book club. We've been reading a range of books from The Wind in the Willows to The Witches. At first they did seem a bit shy and hesitant, but soon they gained confidence over the weeks and they were eager to answer so many questions, ask so many questions and read the books themselves. We've since had so many wonderful conversations, for example, us showing them the snow outside and them showing us their dogs. In the video that you're about to see, you'll see them address us as Akka or Anna, which means older sister and older brother.
Thank you, Yathusia, and thank you everyone else. So what I'd like you to do now is your tutor has been sent a little link for an eStream film. So what you'll see on there is that the students at Parikrama have shared a lot of their lockdown art and also intersperse that with some of their sort of some short videos about the reading programme and how they're getting on over there. So do enjoy that short film. Thanks very much for listening and thank you for all the donations so far. We've had lots of money come through Evolve. So just keep that coming. That's going to be open over the weekend and into next week. So any problems with that, just drop me a line. Have a great half term. Thank you for all the students for doing this morning's assembly and see you soon. Thank you.
Akkas and Annas. I am Mass Class Sandhya. I am studying in Koramangala Center for Learning Parikrama. I am going to tell about my reading sessions. Because of this reading sessions, I can find out the new words and create a new story and poems. Thank you for giving us this big opportunity, Akkas and Annas.
Stories and explain meanings. I thank you for teaching more wonderful stories and explaining meanings. Thank you, Akkas and Simon Anna.
Everybody, I am Devika, studying in 6th grade in Parikrama Center for Learning. It has been a great opportunity participating in the reading program conducted by HABS. Even in this difficult period of time, it has been an amazing learning experience attending these sessions. I thank all the beautiful Akkas and handsome Simon Anna for organizing such wonderful sessions. I got to read different stories written by authors all around the world. The stories were interesting and informative. I learned how to narrate a story and read a story too with expressions. I'm very glad to be a part of this. Looking forward to attend more sessions like this. Thank you for the help and guidance.
I'm Monisha from Parikmataka Nagar. I'm here to share my thoughts regarding the HAB sessions. I've been a part of it since a long time. It has helped me to improve my English vocabulary a lot, and every time I learn something new, which inspires me to read more and more storybooks. And during this pandemic, when everyone are at home, the HAB sessions allowed us to learn something quite knowledgeable and utilize our time appropriately. I'm really glad to be a part of the HAB sessions. Every time they come up with new concepts and the stories are really fun to read. And the words I learn are helpful in my day-to-day life. And the Akkas involved in the HAB sessions are really kind and generous. They explain each and every bit of it really clearly. I'm really thankful for this HAB sessions and I really enjoy it. And I'm really thankful for this great initiative. Stay home, stay safe.
My name is Shani. I am studying in 5th standard Parikrama Koramangala. Today I am going to speak about reading section. Reading section teaches us to read stories, to read new words, difficult words, rhyming words, and teach us to read English so much. We enjoyed reading section. Thank you, Akkas and Annas, for teaching us the stories. We enjoyed so much the reading section. Thank you.
Hi Akkas and Annas. My name is Andrea. I am from Parikrama Book Trekkers. I am studying in 5th grade in Parikrama in Koramangala. I enjoyed HAB's reading. It improved my reading. I learned a lot of new words and meanings of those words. I really enjoyed all the classes completely. Thank you, Akkas and Annas.